Pharmacology of the cardiovascular system, the cardiac cycle. The period of time that begins with contraction of the atria and ends with ventricular relaxation is known as the cardiac cycle. The period of contraction that the heart undergoes while it pumps blood into circulation is called systole. The period of relaxation that occurs as the chambers fill with blood is called diastole. Phases of the cardiac cycle. At the beginning of the cardiac cycle, both the atria and the ventricles are relaxed, called diastole. Blood is flowing into the right atrium from the superior and inferior vena cava and into the left atrium from the 4 pulmonary veins. Contraction of the atria follows depolarization, which is presented by the P wave of the ECG. Just prior to atrial contraction, the ventricles contain approximately 130 milliliters of blood in a resting adult. This volume is known as the end diastolic volume or preload. It is the atrial muscle. As the atrial muscles contract, pressure rises within the atria and blood is pumped into the ventricles. Ventricular systole follows the depolarization of the ventricles and is represented by the QRS complex in the ECG. During the ventricular ejection phase, the contraction of the ventricular muscle causes blood to be pumped out of the heart. This quantity of blood is referred to as stroke volume. Ventricular relaxation or diastole follows repolarization of the ventricles and is represented by the T wave of the ECG. Cardiac output is a measurement of the amount of blood pumped by each ventricle in 1 minute. To calculate this value, multiply stroke volume, the amount of blood pumped by each ventricle, by the heart rate in beats per minute. It can be represented mathematically by the following equation. Cardiac output equals heart rate times stroke volume. Factors influencing cardiac output include autonomic innervation by the sympathetic and parasympathetic nervous systems, hormones such as epinephrine, preload, contractility, and afterload. Each of these factors is further discussed. Stroke volume is also used to calculate ejection fraction, which is the portion of the blood that is pumped or ejected from the heart with each contraction. Factors affecting cardiac output. 1. Heart rate. Heart rate can vary considerably not only with exercise and fitness levels but also with age. Newborn resting heart rates may be 120 to 160 beats per minute. Heart rate gradually decreases until young adulthood and then gradually increases again with age. For an adult, normal resting heart rate will be in the range of 60 to 100 beats per minute. Bradycardia is the condition in which resting rate drops below 60 beats per minute, and tachycardia is the condition in which the resting rate is above 100 beats per minute. The correlation between heart rates and cardiac output. Conditions that cause increased heart rate also trigger an initial increase in stroke volume. However, as the heart rate rises, there is less time spent in diastole and consequently less time for the ventricles to fill with blood. As heart rate continues to increase, stroke volume gradually decreases due to less filling time. In this manner, tachycardia will eventually cause decreased cardiac output. The Cardiovascular Centers. Sympathetic stimulation increases the heart rate and contractility, whereas parasympathetic stimulation decreases the heart rate. Sympathetic stimulation causes the release of the neurotransmitter norepinephrine, which shortens the repolarization period, thus speeding the rate of depolarization and contraction and increasing the heart rate. It also opens sodium and calcium ion channels, allowing an influx of positively charged ions. Norepinephrine binds to the beta-1 receptor. Some cardiac medications, for example beta blockers, work by blocking these receptors, thereby slowing heart rate and lowering blood pressure. However, an overdose of beta blockers can lead to bradycardia and even stop the heart. The autonomic nervous system stimulation of the heart includes sympathetic and parasympathetic stimulation. Stroke volume. Many of the same factors that regulate heart rate also impact cardiac function by altering stroke volume. 3 primary factors that affect stroke volume are preload, or the stretch on the ventricles prior to contraction, contractility, or the force or strength of the contraction itself, and afterload, the force the ventricles must generate to pump blood against the resistance in the vessels. Many cardiovascular medications affect cardiac output by affecting preload, contractility, or afterload. Preload. Preload is another way of expressing end diastolic volume. Therefore, the greater the end diastolic volume is, the greater the preload is. One of the primary factors to consider is filling time, the duration of ventricular diastole during which filling occurs. Any sympathetic stimulation to the venous system will also increase venous return to the heart, which contributes to ventricular filling and preload. Medications such as diuretics decrease preload by causing the kidneys to excrete more water, thus decreasing blood volume. Contractility. Contractility refers to the force of the contraction of the heart muscle, which controls stroke volume. Factors that increase contractility are described as positive ionotropic factors, and thus those that decrease contractility are described as negative ionotropic factors. Not surprisingly, sympathetic stimulation is a positive ionotrope, whereas parasympathetic stimulation is a negative ionotrope. The drug Digoxin is used to lower heart rate and increase the strength of the contraction. It works by inhibiting the activity of the enzyme ATPase that controls movement of calcium, sodium, and potassium into heart muscle. Inhibiting ATPase increases calcium in heart muscle and, therefore, increases the force of heart contractions. Negative ionotropic agents such as including hypoxia, acidosis, hyperkalemia, and a variety of medications such as beta blockers and calcium channel blockers. Afterload. Afterload refers to the force that the ventricles must develop to pump blood effectively against the resistance of the vascular system. Any condition that increases resistance requires a greater afterload to force open the semilunar valves and pump the blood, which decreases cardiac output. On the other hand, any decrease in resistance reduces the afterload and thus increases cardiac output. Calcium channel blockers such as amlodipine, verapamil, nifedipine, and diltiazem can be used to reduce afterload and thus increase cardiac output.